So you may have heard about bioidentical hormones and wondered what they are, or perhaps you're already taking them yourself. Bioidentical hormones are derived from a natural plant-based source, and they're biologically identical to the hormones already in your body. They're chemically and structurally identical to what you have, and therefore your body, when it receives these bioidentical hormones, recognizes it as if it produced it itself. And the types of benefits that can be achieved with bioidentical hormones are many. For some people, a lot of people learn about bioidentical hormones, are interested in taking them when they go through the menopausal period for females between the ages of 40 to 60. And for males, they also go through something called andropause around that age, where their hormone levels take a big nosedive. But the reality is that hormone levels steadily decline after the age of 30, even before they take that big nosedive in the 40s. And so if we can improve your hormone levels and get them back to where they were in their 20s, you can get a lot of physiological benefits and symptoms that you can actually feel and appreciate. And a lot of times what we'll do is we'll put your hormone levels not just back to where they were in your 20s if they were in the low normal range, but we'll bump them up higher. So the types of benefits that can be achieved with hormones are things like easier to lose fat. If you ever noticed after the age of 25 or so, it gets harder and harder to lose fat. So another great benefit of the bioidentical hormones is you can have improvement in muscular strength. If you work out at all in particular, you'll notice the differences right away. You'll be able to put on lean muscle as well as get rid of fat much more easily. Then there are a lot of mood stability type symptoms that can be improved, but not everybody has mood and stability problems. It can help with things like energy and fatigue. It can just make you feel stronger, more vital. As you age, sometimes your mind just becomes less sharp and you have some foggy thinking. Well, that's all related to your hormone levels, and these can all be improved with bioidentical hormones. And for those people who are going through menopausal symptoms, such as when they're achieving things like night sweats and hot flashes or vaginal dryness, and for men when they get decreased erectile strength or decreased libido for either sexes, these can all also be improved with bioidentical hormones. But the key is you don't need to be having any particular symptoms to feel the benefits of taking them. So there are some different delivery methods of how you can actually receive the bioidentical hormones. They come in a variety of different forms. Gels and creams, intramuscular injections, oral medications, and pellet form. But the best method is with pellet therapy, and that's the form that I use. Pellets come in the size of a grain of rice or a Tic Tac, and they're compounded in a pharmacy. I select the correct hormone dose for you, and then I can painlessly insert these into the upper buttocks and hip area, into the fatty tissue. And they lie in the fatty tissue and they slowly release the hormone over 3 months for females and over 6 months for males. So the advantages of that are that you don't have to think about the other methods and remembering to take the medicines, and you don't have any of the messiness that comes with creams, and you achieve a much better steady level in your bloodstream. There are also some other benefits, which include the fact that by having this reservoir and deposition of hormones already in your body, steadily releasing, your body can self-regulate and draw off more of the hormones if needed under times of stress and activity. When there's an increased need, your body can auto-regulate, and that's how your body works right now. And the best part is that the price for the pellet therapy is actually less expensive than the other forms of bioidentical hormones. We charge $325 for 3 months for females. For the males, it's $650, but it lasts 6 months. So it works out to about $100 per month for either males or females, and this is cheaper than other forms of therapy, but you have the advantages of the pellet therapy over those other methods. So if you're interested in doing any of these bioidentical hormone treatments, all we would need to do is check your hormone levels before treatment. Then I select the correct hormone dose based on the symptoms you're trying to achieve, your body type and age, and we place the hormone, the pellets into the subcutaneous tissue, and then we recheck the hormone levels again 5 weeks later when we achieve the proper highest peak concentration of plasma levels in the bloodstream. And then based on what the hormone levels are showing at 5 weeks after treatment, along with the symptoms that you're having improvement with, we take those two together to determine whether we need to make any adjustments.